Chapter 1, Episode 30. Remember the statistic from the beginning of our lung health series. About 19,300 Canadians are projected to die from lung cancer in 2026. That's approximately 53 people every day. But where do these lung cancers come from? And if you've never smoked, are you safe? Smoking remains the biggest preventable cause of lung cancer. In Canada, about 72% of lung cancer cases are attributable to tobacco smoking. The longer someone smoked and the more they smoked, the greater the risk. But quitting matters. Lung cancer risk decreases after quitting, although former smokers can remain at increased risk for many years. But lung cancer isn't exclusively a smoker's disease. People who have never smoked can develop it too. Important risks include radon, asbestos, secondhand smoke, air pollution, certain workplace exposures, and family or personal history. And sometimes lung cancer occurs without an obvious explanation. One risk deserves special attention in Canada: radon. Radon is an invisible, odorless radioactive gas that can accumulate inside homes. Health Canada identifies radon as the leading cause of lung cancer among people who don't smoke. And here's the problem: you can't see it. You can't smell it. The only way to know the level in your home is to test for it. Another established lung cancer risk is asbestos. It may still be present in some older Canadian homes and buildings, particularly in materials installed decades ago. Asbestos becomes especially concerning when asbestos-containing material is damaged or disturbed, releasing fibers into the air. If you're renovating an older property and suspect asbestos, have the material professionally assessed rather than disturbing it yourself. Early lung cancer may not cause obvious symptoms. When symptoms do occur, they can include a persistent or changing cough, coughing up blood, shortness of breath, chest pain, unexplained weight loss, or unusual fatigue. But remember what we learned earlier: most coughs are not lung cancer. The concern rises when symptoms persist, change, or occur alongside important risk factors. And this is extremely important. You could have an SpO₂ of 98% and still have early lung cancer. You could even have relatively normal lung function. Remember, SpO₂ measures oxygen. Spirometry measures airflow. Neither one is a lung cancer screening test. So can lung cancer be found before symptoms appear? For people at sufficiently high risk, the answer can be yes. The screening test is called low-dose CT, or LDCT. It creates detailed images of the lungs using a lower radiation dose than a standard diagnostic CT. But lung cancer screening isn't recommended for everyone. Eligibility depends mainly on factors such as age and smoking history, and Canadian programs can have specific provincial criteria. If you have a substantial smoking history, ask your healthcare professional whether lung cancer screening is appropriate for you. Over 5 episodes, we've learned something important: lung health isn't just about smoking. Pay attention to persistent cough and changes in breathing. Know what your blood oxygen level means. Understand when doctors may test your airflow. And most importantly, know your personal risk factors. Your lungs work for you every minute of every day. It's worth learning how to protect them.